Good evening and welcome to Resolutions for Recovery. This show is dedicated to the empowerment and education for the general public. We have an epidemic right now nationally, certainly here on Long Island. Suffolk County is the #1 county in the great state of New York for overdose deaths. So not something that we should be proud of, something that we need to start to turn the tide on, and we are certainly working towards that. So Thomas's Hope Foundation is proud to be working with Family Children's Association, and we're going to come into my guest. That's our lead into Meghan McLeod, who's here from Good Samaritan Hospital.
Yes.
And at Good Sam, we have our pilot program for the Sherpa program, which is bringing certified peer recovery coaches into the emergency room to deal with certainly the affected person that's suffering from either an overdose or alcohol or any other substance. It doesn't necessarily have to be opiates or heroin. And then Thomas's Hope is providing the family support for the people who come up there that may not be their first rodeo with this happening, but certainly it can be, and helping the family through the crisis. Thank you so much for your time tonight,
Oh, well,
Meghan.
Thank you for having me here. It's really an honor.
You are a rock star.
Oh, thank you.
All the coaches love working with you. You know that. And I think we've made a difference there.
I agree. I think it's been a wonderful program so far. It really fills a void that we've had in the emergency room and treatment in general. Especially when it comes down to the family element. Prior to coming to Good Samaritan Hospital, I worked at St. Charles in their detox, and families were left outside.
Yes.
And I find that now the families are finally able to be involved and get their own help, and I think that's been a wonderful thing for a lot of these patients who've been coming in.
Unfortunately, even when I went through it with my son, a lot of times we get to treatment or we get here, and you're told, you just go home. We're going to take care of him.
Correct. Yes.
And if someone had said to me, "We need you up here 3 nights a week. You're going to get your own counseling on substance use, and we're going to prepare the family for when Thomas comes home, and work through some issues that you may be having with other siblings." If they had said that, I would have said, "I'll be here 5 nights a week." Absolutely. Or they would have heard something like, "That's not my problem. I'm not coming up here." And that would give you, as a social worker, note to self, home is not a good place as a discharge plan for this patient.
Right, it gives an accurate representation of what kind of support system the patients typically have. And what I've seen at Good Sam, which has been really an honor for me to see, is the patients are coming in with their families, and you're seeing exactly what they're going to be going home to a lot of the time. The patients are getting services that they otherwise wouldn't get in a typical emergency room. Prior to Sherpa coming in, my role would be to go over to a patient and say, would you like some resources? I can give you a piece of paper essentially with phone numbers, and you can make some calls after you leave here. Well, that's all well and good, but the motivation is going to leave.
Yes.
So when you have somebody who actually can take the time and come in and sit with the patients and really get to know what's going on and connect with them and help connect them to services, it's a totally different experience.
Yes, and somebody that, so the peer recovery coach with the patient has had lived experience.
Yes.
So, when you meet somebody where they are, with no criticism, judgment, or anything else, and someone just willing to listen, makes it's just love, really. That's what it comes down to, is just, the hospital staff is so overworked. You have, how many beds in the emergency room?
Oh my goodness. we have at least 80 patients
Yeah.
any given night.
So there's a
Yeah.
lot going on at any given night with
Yeah.
emergencies always popping up.
Right.
It's
right.
not the ideal place, you know, and people fall through that gap.
Yeah, and you try to do the best that you can, given what you have and given the time frame and the sheer amount of patients who are coming in with different issues.
Yes.
As an emergency room social worker, you're not just working with patients with substance abuse. You're working with patients who have mental health issues. You're working
Yes.
with housing issues and abuse and violence. And you're just trying to help everybody the best
Yeah.
you can. And where Sherpa's coming in is that they're able to actually take that time that we just don't have.
Correct.
So,
You just don't have it.
yeah, I mean, you
And
know, we
it's-
try the best that we can, but it's really, I think it's been so helpful for our patients.
You know, and it's just their friend, you know, they
Yeah.
can't talk to their family because they're embarrassed. There are a lot of things. They're ashamed, you know, all of those things. And I know for Thomas's Hope, we take the family and we take the emphasis off of, okay, your loved one's being well cared for. What can we do for you right now?
Right, right.
Let's work on your crisis right now. What else have you been going through? And finding out, what does home look like? You know, because there's, I'm sure, you know, a lot of times when there's other siblings there, they're so angry at
Right.
what's going on in the household, and encouraging them to get their own help.
It also gives you kind of an accurate picture of just exactly what's happening. You know, I've had patients come in that I've known now for a few years between the
Yeah.
hospitals I've worked in. And just seeing them in working with this program as opposed to what I've seen them do in the past, it's been really eye-opening. So I'll hear a story from someone telling me one story about their family, and then I'll actually hear about the family, and it's not, the two things don't always connect. So you're kind of finding out exactly what's going on at home. You know, I've found that these patients have been doing really well comparatively, and it's kind of nice to know that once they come into the emergency room, they meet with the peer coach, and they, you know, they're being followed. Someone is calling them and checking on them to make sure that they're going to be, that they're doing what they need to do and they're going to be okay, and following up. And that's something that I've really never seen before.
You know, so especially the identified person, just having someone call and say, how are you doing today, is totally a
amazing.
different experience for them, because unfortunately they've burned their bridges so many times
Right.
before. And sometimes, I'm sure you've seen it much more, is they're paralyzed to go and do something again. You know, you hand somebody a piece of paper. That's when you are physically going through withdrawal and having that kind of pain, the last thing you want to do is make a phone call.
Just pick up the phone and,
Yeah.
you know,
And
just,
engage with all the other stuff that you have to do on the phone.
right. And there's a lot of hoops you have to jump through with
Yeah.
treatment, you know? So, I mean, on our end, we're used to working through it, talking to the people who work in admitting in a lot of these facilities and setting them what they need. And that's us at work as a licensed professional working, you know, so somebody who's just coming off the street, making this phone call and being asked to do X, Y, and Z before they go into treatment, it's
Daunting.
It's daunting for me sometimes as the person who has to make that connection, and I have all the tools in front of me. So someone who doesn't
Right.
have that in front of them trying to make that call, it's just,
And again,
Yeah.
when we're talking about somebody, because we know that the treatment facility needs to talk to the patient,
yes.
and they're not clear-headed.
No.
Especially if they've just overdosed. So we're not in great shakes to begin with.
Right.
And the last thing you want to do is hang out on the phone answering 9,000 questions. And unfortunately, we both know with insurance, they may or may not get treatment. They may get treatment for 3 days. And again, it's that disappointment for them. See, I am not worth, even my insurance company doesn't think I'm worth treating for longer than
Which
this.
is so sad, which is just...
It's disgusting.
It is disgusting. Like I said, a big part of my job was being on the phone with the insurance company and having this fight day in and day out with the insurance company about what should be covered, what shouldn't. Oh, they've been to treatment X amount of times. Oh, this is my favorite, they're only using heroin. So, and we think, oh, what?
Only heroin.
And it blows your mind,
yes.
because in their eyes, well, you know, it's withdrawal is uncomfortable.
But won't kill
But
them.
it won't kill you.
Right.
So you have someone who's desperate for help.
Yes.
And they cannot receive that help because the insurance company is turning around and saying, you only use heroin. So now they're using other substances to try to get into facilities that they otherwise wouldn't be using.
Right. So let's start with some Xanax, because that
Absolutely.
one they can't say no to.
Mm-hmm.
But mixing those two drugs can kill them.
Yes.
Like, you know, when my son, we were at a treatment facility and they said, I don't even remember how many bags he was actually shooting a day.
Right, right.
And they said, he's not high enough for treatment. That one still really messes with my mind.
It
like,
has to.
how many bags should he, you know, should we go outside and he should do some
use
more,
more?
and maybe he'll live through that so that he can reach that magic ring that he has to, so, you know, that golden
Right.
ticket that
And
they all reach for.
Right. And I mean, and us as professionals, to say that to a parent or to have to tell somebody that they cannot be admitted to the program or go somewhere, it kills us, because
Of course it does. Yeah.
we don't feel that way. Listen, if it was up to me, I'd have everybody admitted everywhere. That's just how it would be. But you know, you have to communicate that to these families, and it's just a killer.
And these families, we both know how expensive healthcare is.
Absolutely.
So, right, insurance premiums. I paid my premiums all those years, and I had coverage, but it always eluded us because well, he hasn't. You let him fail at outpatient. He always had to fail.
Correct. Yeah.
Before you get. That's the only disease that this happens with.
This is correct. Yeah.
So would you tell a diabetic, you know what? I'm sorry, we can't help you because you've been in a coma before and you did it again. So
here we are.
So we're not going to treat you right now. Mm-hmm. No, doesn't happen.
Yeah, this is the argument we have all the time with people. Yeah.
It's disgusting.
It is. It really is. And you know, it's a shame people still feel that way, unfortunately.
It's curious, though. I wonder if treatment looked like you went inpatient for 6 months and you did step down. How successful do you think treatment would be if it could encompass a year?
Right. I think it would. I think it'd be incredibly helpful.
Yeah.
And I think it blows my mind that they want to start with outpatient, fail numerous detox programs. You know, they want everyone failing everything. And I'm wondering, what would the cost be? What would the difference really, truly be if you were to start someone at the highest level of care and move down? I mean,
it just
I'm
makes
not
sense
sure.
because,
Yeah.
I mean, obviously, in an emergency room situation, coming in on an overdose, right? That level of treatment that person is getting is probably one of the highest, most expensive level of treatment. And the first really 14 days in a treatment facility are the most, until you get them, you know, what's the word, stable.
Right.
Those are the most expensive days. The rest of the time is not. It's really kind of, you know, room and board and meds, because now we have a stable person that we really can make some, you know,
right. That's
progress
when the
with.
counseling comes in.
Yes.
It's less of the medications.
Yes.
Absolutely. I mean, and that's just, honestly, you have someone coming in for an overdose, you know, they're seen in the emergency room, they're held for a little while, you know, if otherwise they're medically okay after that, they can leave.
Yes.
But then when we talk about patients who come in who are chronic alcoholics, who come in and they come into the emergency room and then they're in the ICU for weeks. Talk about that medical bill. See,
can't
this
even
is-
imagine what that
yeah,
medical bill would be.
I'm sure it's astronomical. I don't know the
Astronomical.
exact number, but this
Well,
is
as
the
soon as
point
you say
that they've-
ICU,
forget it. Yeah. I'm sure it's.
but you can die from alcohol
You can.
withdrawal.
Absolutely. Absolutely.
Never mind that during the progression of a fatal progressive disease, especially with alcoholism, and we don't talk about alcoholism enough because that is a chronic disease. So you're going to have many health, problems during the progression of a 20-year
Oh, yeah.
alcoholic, right? And their family, and the stress on the family, which leads to their own diseases, high blood pressure, all of those things. So we're talking about something that if we treated it in its infancy, what would it look like? I'm always,
Yeah.
So when parents say, oh, he's just smoking pot, really? Do you think that's innocuous to their well-being? Crazy. Are you seeing more marijuana-related?
I have seen a lot of marijuana related issues. Like people will come in, a lot of it has to do with marijuana laced with something else. They'll come in very agitated or confused or just aggressive things. I'll see things of that nature. And I see marijuana as almost as an add-on. I know that sounds wild, but it's almost as people don't think that doesn't even matter. So
Right.
like I'll go see a patient for a screening. We do screenings at Good Samaritan as well, just to see if we can help someone at the beginning of an addiction. So I'll go in and see someone and they'll say that they use drugs other than prescribed for medical reasons. And I'll walk in and they'll say, oh yeah, I just smoke some pot sometimes. Like they don't even know why I'm there, what I'm talking about, or why it's an issue. So I have found that they're it's just, wait, that's my Tuesday night activity. What's the big deal?
Right, because
Right.
we're legalizing it,
Right.
we're doing all of these things, so it is no big deal.
Right. So, but then I'll also see patients who, their tox screen will come up
Lit up.
Lit up, yeah, like bright red, lit up. And I'll go over and ask them what they're using, and they'll tell me they're using heroin. They'll tell me they're using Xanax. They'll mention the crack, but they don't always mention the marijuana or cocaine. Cocaine is starting to fall into that same.
As a nonchalant Tuesday night activity.
Yeah, exactly.
That's crazy.
Yeah, I always found that to be very interesting. Like, you're not going to mention the cocaine that's in, and cocaine takes it's very quick to come out of your system. So you've used it recently.
Right.
So
you've used it probably within the last 48 to 72 hours.
Right.
And that just slipped your mind? Wow.
Yeah, just
With young people, what are you seeing more, like someone under the age of 25?
Okay, so that's a lot of heroin.
Yeah.
A ton of heroin. Benzos are also very big.
Yeah.
Xanax, Klonopin, and again, marijuana.
And marijuana. And they don't understand how strong marijuana is in today's world.
No.
Yeah, the THC is unbelievably, especially when they're dabbing with the vape pens and everything else.
Yes.
They just don't understand what they're doing to themselves. It's interesting, this morning they had on the news that suicide in young people is at an all-time high.
Yeah.
And in July it will go down. So what are we doing to our kids in school or in society that makes them so need to escape and or need to kill yourself? It's something that we really need to start to look at more and more, because they are unfortunately being successful way too many times. And it's such young ages, 12, 13, 14.
It really
Frightening.
is. It's very sad. And as an emergency room social worker, I can speak to that as well, because they come in. These young kids are coming in depressed and wanting to die, or have made suicidal gestures or attempts, or this has been an ongoing issue for them for a long time. And I'm seeing, and again, at these young ages, these 10, 12s, you know, you're getting, you know, there's teenagers, obviously,
Yes.
as well, like the 16, 17, but you see it younger and younger. And
any reason that you can see why?
I mean, there's a lot of issues with bullying.
Yes. Social media.
Social media. Bullying is not what it was 15 years ago. You know, you couldn't just go to school and then leave and go home. It's you go to school, you go home, and everything's on your phone.
Yeah.
You know, so that's a big issue. And then just
So
a lot of family stress too.
Yeah.
You know, that I've seen. But I feel like the social media and the bullying has really been a big part of it.
I think, you know, when I was a kid, like you said, if you had a problem at school, you were either meeting somebody at the flagpole at 3 o'clock, right? At the end of school and straightening it out, or you went home and you felt safe.
Right.
You got in the door with my family. I'm not going to be bothered. I don't have to answer the phone.
Which was your house phone ringing.
Yes,
So.
which was your house phone. And I didn't, you know, there wasn't, it wasn't posted everywhere. And my heart breaks for them. But as parents, then I beg to say, why does your child need a smartphone? I know why you and I need a smartphone. You need to be connected, right?
Right. And as a mom, I think, you know, oh, I would like to know where my son is. I'd like to be able to reach out to my son and find out where he is. I mean, he's 6. He's not anywhere.
Well,
I don't know. I know
exactly.
where he is. Yeah. But, you know, I could see, like, as a teenager, wanting to know where my child is or wanting to be able to check in. But, I mean, it's tough because all the other kids have the smartphones, too. So, do you want to be the...
It just takes a group of parents to actually communicate with one another and say, are you happy with, you know, Twitter and all of Instagram and all of these? I'm not happy with it. How can we change our group of kids?
I mean, I see some hope for the future. I really do. Just my son's in kindergarten. Okay. And I see they're doing things in school that we never did in school. So in the morning, and it's very cute actually. In the morning they say the Pledge of Allegiance, and then after that they have the character pledge at their school. So every morning the kids talk about being good people, taking care of one another, and treating each other with respect.
That's beautiful.
And you know, I thought it was a wonderful thing because these kids now are being taught
it's mindfulness.
Right. Absolutely. So this is the beginning of his school career right here, and he is starting it with a character pledge. I just think that's a wonderful thing.
That's awesome. Yeah. Every school should, you know, and that's been my thing too, is I do a lot of prevention work, which is ironically interesting that I would do that. But parents need to know that you can't start the conversation at age 14. They're well off to the races. But in school, that's prevention.
Yeah.
That character pledge is prevention. Did we talk about drugs and alcohol? No, we did not. But we talked about being a mindful person and caring for one another and doing no harm and opening up communication. So when he does come home and say, you know, I helped so-and-so, and you can praise that. Or, you know what happened today? So-and-so picked on, and you can say, well, how did that make you feel?
Well, they get rewarded too for being caught doing something good. It's this bucket filler mentality. So I think that they really are trying now to change the atmosphere in schools. I really do. I mean, listen, he's 6. I don't know what's going to happen in 5 years. I don't know what things are going to look like, but I think that they are taking the right steps to try to make school a better, more comfortable place for kids.
But when you teach a 6-year-old, a kindergartner, to be caring about their classmate, instead of, you know, it used to be, well, if you pick on somebody, both of you are in trouble. Well, no, that's not right either. No. It's the wrong message that you send. Right? So we need to be, we have to be so cognizant of covering everything.
Absolutely. Absolutely. And, you know, I mean, I've always been very open with my son about what I do for a living, too. I mean, I know he, again, 6 years old, you don't think he's going to know anything about drugs or alcohol or anything like that, but he's very well aware. He asks me what I do for work. I tell him what I do for work. Like, he's very well aware of problems that people have. Sometimes people have problems and we need to help them, and this is what mommy does for a living. So, you know, I'm trying to, you know, be open and say these are the things that are happening in our world right now.
You know, my daughter, you know, Jen,
I do.
had a baby
She's
at
lovely.
19. So we have a 10-year-old,
Right.
and he lived through the death of his uncle. And you know, now when he asked me all through when he asked me a question, it was age-appropriate answers for the moment in time, but we couldn't hide it.
Right.
And he needs to be aware, because certainly his risk factor goes up, but he also just, you know, those age-appropriate things. You know, a lot of families struggle with grandparents that may have a problem with alcohol.
Right.
You know, we don't hide from that. We just say, you know, grandpa or grandma or whoever has a problem and we can't visit them today because they're making, you know, unhealthy choices right now.
Right.
So, you know, my job is to protect you. But, you know, when you build those kind of things in, it's not a shock, it's not anything, and it's also comes with a caring attitude.
Correct.
You know, and this is what we need to empower our young kids with, so that, you know, God forbid he does see something, that he wouldn't be afraid.
Absolutely.
And it's not tattletaling, it's being, you know, his neighbor's keeper. Big difference.
Right.
Big difference.
Right. I mean, I think that we unfortunately shield kids from a lot of.
And they're well aware of it.
Yeah.
We'll pick up. We're gonna be right back after this message.
My age is 18 years old and my name is Evan.
My name is Sean and I'm 19 years old.
My name is Justin, I'm 16.
My name is Angelica. I'm 18 years old.
Marijuana, and I was 13 years old.
Marijuana, and my age was 13.
The first drug I ever tried was marijuana, and I was 12 years old.
It was marijuana and I was 11 years old.
Yes, and that escalated to promethazine, lean.
I began to take pills like Xanax, Percocets.
I began using other substances such as pills and alcohol.
I then went on to cocaine and pills and quickly progressed to heroin. I was 13 years old when I first started using heroin. I had like aspirations of going to like an Ivy League school, and that quickly, within like a year or two, changed. I stopped going to my classes, I stopped going to school altogether eventually. All my friends were kind of just dropping me.
I started getting in trouble in school, eventually kicked out. I got in trouble with the law a lot.
I wasn't really hanging out with a lot of sober people, just people that use. I overdosed at 15. I've been at Outreach for 5 months. Outreach honestly really helps you. It shows that you're honestly worth something. And it's possible to become sober if you put in progress. But it's not just gonna be handed to you, you really have to want to change. Inpatient, you can't just leave. You stay here and you have to deal with it. That's what I feel like a lot of kids need.
In a long-term facility, the counselors get to know the resident better, and they get to actually work with them more than in a short-term 28-day facility. And it really gives kids a chance to work on themselves rather than being rushed through a program, just to be thrown back into life, going back into the same old bad habits that they were doing before.
Coming in here, I couldn't believe how long I would have to be here, but after a couple months, like, you know, talking to counselors, I kind of came to the realization that, like, I need a lot of time and work to repair everything I've done.
The things that we get taught here, you know, it really does help you in life, and it gives you a different perspective. It's very important for a kid to have a family involvement in treatment so they don't think they're alone in this. We communicate on a better basis than how we used to. We understand each other more. And that was from the help of outreach.
They come every Wednesday night for support group. They come to a group every other week.
They come to parent support group to discuss their problems also. My relationship honestly has got a lot better. Because I remember my mom used to never want to say anything to me because she would be scared of my reaction. I'm starting to realize in here, like, I really have to take advantage of the fact that I have her still.
When I was about 14 is when my parents realized that I had several different problems, such as behavioral issues, and the behavioral issues kind of stemmed from my drug use. I began caring less about myself and others. Outreach has really made me realize how important family is. If I was out of state in a program where my parents were not involved, I would have never been able to strengthen my relationship with them. My father told me that I've inspired him to make changes in his life, and that meant a lot to me. I've never heard my dad be inspired by something before, and I was just proud that it was me.
Welcome back to Resolutions for Recovery. And Megan and I are just talking about the awesome Sherpa program. I'm so proud, you know, having lost my son and going to Albany to fight for my vision of what really, you know, just helping families. Because for me, going through that all by yourself is just, it should never happen. And you don't have time at work to talk about what's going on because you have to be present at work, and you can't slip into an emotional wreck because you're already there. So, you know, for me, I was never ashamed. It was just, I had to be present because as a financial advisor, I have to be in a good frame of mind.
Right.
But not knowing who to call, when to call, how to call, what to ask for, because the first time he literally went to treatment, I thought, oh, he's going to come back and he's going to be okay, because no one explained anything different to me.
Right. You think it's going to be the magical cure. It's going to be
Exactly.
Okay. Right.
And why wouldn't I think that?
No, of
Because
course
no
not.
one sat down and said, you know, it is a brain disease. And this is something he will struggle with or work on for the rest of his life. Nobody explained that to me.
Right. Right. So you had to find that out all on your own.
Oh, boy, did I find
Oh,
that
yeah.
out all on my own.
Right.
You know, because in an adolescent brain, needless to say, when you have an 18-year-old going to treatment, maybe he's 14, 15 anyway,
Right.
and that's where he stopped. And they're allowed to make choices, right?
Yes. Yes.
So let's, you know, how crazy it is. What is the age for consent for a child to say, I don't want mom and dad to know?
I'm under the impression it's 18.
I think you would be surprised that a 13-year-old can say, you don't tell my parents why I'm back here. It's younger than that.
Wow. Wow.
As a parent, and you're a parent, we're fiscally responsible
Right.
for our children to age 21, but let's even say it's age 18. When they can tell you, no, you're not going to know. And I know it's younger than that because kids can go. And
Right.
believe me, I'm not against them being able to get birth control or different things. But when there's a health crisis, then there's a health crisis. You know,
Your child's life is in the balance.
Yeah, when obtaining birth control is not going to make them or break them. At least they're cognizant enough to get that, because now, I mean, in today's day and age, with kids doing substances, is Hep C on the rise?
Oh, that was almost a given with a
given.
lot of my patients. Yeah.
And HIV. Because we created a generation that doesn't need to be educated on that anymore, because we really did do such a great job. They don't know about sharing needles, about, you know, unprotected. They do know about unprotected sex. However, when you're doing drugs.
Oh, you're not thinking about that.
You're not thinking
No,
about
my
that. And now we have young women and probably even young boys that are going to do almost anything
Right. They are.
for that fix. So, you know, girls selling themselves and or being passed around.
Right. Which then results in a lot of trauma. So now,
Oh, my
in
goodness.
addition to the substance abuse issues, now you have somebody who's gone through a horrible trauma, and now they need to have, you know, the substance abuse will go up.
Yes.
They need to have that mental health issue addressed.
Yes.
And don't even get me started on the lack of services for that either. So, I mean.
I know. I
Right.
know.
Yeah.
Because that's, and you know what I have noticed just by being so involved with this is that really with young women or young girls, probably dad even more so than mom want to protect their
Yes.
not my little girl. No, we're not going to. They don't put them out of the house. Maybe for doing the same thing as maybe their son would do, but the girl is kept at home
Oh,
and
it's
their
different.
disease is allowed to really flourish, right? And then we have all this trauma that's, you know, and it's trauma somewhere, especially in young girls, that leads to this.
It's a way of coping.
Yes,
It's the easy Band-Aid.
it's the easy Band-Aid.
Yep.
And sometimes, like you just said, with other mental issues going on, it makes them feel normal. It's the one thing that makes them feel normal.
And you know, there's such a stigma surrounding psychotropic medications even. I've seen many patients who've come in who have no problem. They're using heroin, they're using cocaine, other street drugs, like they're okay with that. But when I suggest the idea of going to a psychiatrist and having them maybe prescribe an SSRI,
Right.
the idea of, oh, I can do this without medication. They don't want to even
Right.
think about
I don't want to
taking
be
an
on
FDA
medicine.
approved, you know, they don't even want to go that route.
I don't want to be on medication for the rest of my life. It's going to make me
Right.
feel not like myself. Well, what is what you're doing?
They don't probably even know what they're supposed to feel like
No,
at
they
this
don't.
point. So,
Right.
you know, and it's a difficult thing because we do have patients who come in and they do clearly have mental health issues that need to be addressed. It's just you can't address them directly until they're not using the substances.
Yeah.
And those two go together so much. It's like you have to stop using the one thing that you're using to cope with your mental illness. So it's kind of a double-edged sword. You don't know.
And the services for mental health
Right.
are really so non-existent.
Oh, they don't, yes. Mm-hmm.
And it's, you know, but now I do know that there are some testing that can be done to find out if a medication will
Correct.
work, which is so freaking amazing to me.
Yes, yes.
So instead of, you know, because a lot of the medication you have to be on, right, for 4 to 6 weeks before it really is going to make an impact on your
Right.
life. 4 to 6 weeks.
That's a long time to
That's
wait.
4 to 6 hours can be a really long
Right.
time.
Right. I have a colleague who's a nurse practitioner who is using, I'm
The
not sure, the
testing?
testing.
Yeah.
And she said it's made a really big difference in her practice, that it's really been very helpful for her.
Is it blood work or is it
I
saliva?
believe it's a saliva. I believe
Yeah.
it's a swab. Yeah.
I think it's a swab too.
Yeah.
And they can tell right off the bat, well, you know, which antidepressant will work, which, you know, all of those things. So you can jumpstart somebody and say, I know this is going to make you feel better.
Right. But again, we all love insurance, right? So
I
that's
know.
so I do believe that they're trying to get this test on some of the insurance panels. I just believe that there's again a delay. So, yeah.
But they'll pay for 6 weeks worth of
This is-
unnecessary
yes.
medication. So, you know, it's such a crazy thing because, you know, unfortunately, the prescribing of painkillers has brought an
Yes.
exorbitant amount of people into this, into substance use. So, amazingly enough, I know too many parents that have lost their kids. They were given the prescription for painkillers. It was The office visits were paid for, the drugs were paid for, and when the patient developed a problem,
Oh, no.
we're not paying for that.
No. I mean, it's just so sad to hear that, because, you know, you have these kids who will have like a lacrosse injury, a football injury, something that, you know, otherwise a kid who's not involved in using drugs at all has to deal with, and now it's your life has gone in a completely different direction because you hurt your ankle. You know, this is, you know.
Well, 12 days on any prescription,
Yes.
you are going to be physically dependent on it. So that has nothing to do with the brain disease, but once you're
No, now
physically dependent, you're physically dependent. It's
Right.
going to lead you right down that
Right.
road.
You know, and that's, you know, some people are like, oh, a lot of people don't agree with the brain disease.
And
piece
it's a
of it.
choice.
It's a choice. And then we look at situations like this where, okay, so you hurt your back. What was your choice?
Right.
Where was your choice? Where was it? Because you went in, you were in pain, you needed to stop that pain, and now here we are.
Right. Where was your choice?
Where was your choice? You didn't have one.
You know, it's amazing. So here's and this just happened. I did an interview with WPIX Channel
Right.
11 on, you know, Mayor de Blasio is going to be opening some injection sites.
Yes.
Very controversial. And I'm not saying that I agree with it or disagree with it.
Right.
But we have to start thinking outside the box.
Well, people don't like to think of, people want an all or nothing answer, I
Correct.
find. So the concept of harm reduction is lost on a lot of people. They
Yes.
don't want to even hear about it.
I know.
You know, so the idea is, you know, it's just someone can use
Yes.
and then not die.
And not die.
You know, I mean, my understanding in the injection, from hearing about injection sites that do exist, is that there are resources available at these injection sites. And this is a place to get somebody, you know, just to put the idea in their head.
If 10% of the people that go in there to use end up seeking treatment, then we've done a really great job.
Yeah, yeah.
Because what will end up just organically happening is, wow, my friend came in here, they got well. So that plants seeds into all the other people that are there.
Right. I mean, and just the idea that you're willing to go to an injection site, like that, I think, is a big step to take
Absolutely.
in general. So now you're removing yourself from your
the street.
home alone. You're making that conscious choice to do something for yourself that you know could be helpful. The wheels are already spinning.
Correct.
You know, I think that's
The process has started.
It has started, because you know this is a problem and you know that you need to do something about it.
But on the comments to the piece that aired, well, you know, I'm glad her son is dead. You know, the lack of knowledge
sick. Yeah.
regarding the disease, and this is just stupid. You know, again, I never said I agreed with it or disagreed. I would have said to my son, why don't you go there? Listen, with fentanyl and everything, and you could be someplace safe where you get that one more chance at living. That may be your bottom. We don't know when anybody's going to make the choice to go for help.
You don't.
Why would you take that away? And what people don't realize is they think that your tax dollars are being spent. They're already being wasted, because
Right.
how many kids that I know that their parents have coverage and they have to disown them and get them on Medicaid. So every taxpayer in New York State, you're paying your health care premiums and you're footing the bill,
Right.
and we are each allowing the insurance company to get richer.
Which is not something we want.
Which is
not
not
at
something,
all.
you know, listen,
Yeah.
they're allowed to make a profit. They're not
Sure.
allowed to pay their CEO a $5 million bonus at the end of the year, because what they're saying is, you're either not going to be our insured, so we won't pay your claim. you'll be dead and we won't pay your claim. We just want to hang you out long enough that we're not paying the claim.
Right.
And that's exactly what's happening.
Sickening.
It's disgusting.
It's absolutely sickening.
Yeah. But they're one of the biggest lobbies
Right.
in the United States.
So fighting.
Believe me, I've
very...
been in Albany and had them following me. Had them following me and going into each legislator's office afterwards saying, you better, you know, because in 2014 we changed insurance law. 2016 we changed more of an insurance law, and they just keep circling back and finding a different way to say no. But now they kind of are on the run because we have educated the consumer to fight for their right.
Well, yeah, I mean, and that's really a long
And that's
time
what it has
coming.
to come.
That's
yeah.
what it has to. Yeah.
It has to happen. It's not easy,
Yeah.
and it's another part of the fight. But
I find that people also don't understand really how insurance works. I mean, it is you open your EOB, and it's just the whole thing is so confusing. It's numbers and I mean, you have to really sit there and read that fine print to see exactly what is happening. So it is intentional. I feel it's intentionally confusing, but I've had people call me and say, what do you mean they're not covering it? I pay good money for that insurance. They should, I'm confused. Like, they don't understand that insurance companies do have the right to turn around and deny something.
correct.
And
or charge you that awesome co-insurance.
correct. Yes. Which is,
You know, and I full disclosure, last summer my mom died of colon cancer, so I have to go frequently. We have to go for colonoscopy. You know, we have
Absolutely.
to take care of our health care. Well, I had all that done, and the insurance company paid half of it, and I have to pay $6,000 of it. Like, did you
Yeah.
pay half my premiums for the year? Why wouldn't that be covered? You know, it's mind-boggling.
it is.
So they are shifting, they raise premiums and they shift more of the burden onto individual patients. And it's not right
No, it's
in any way,
not at
shape,
all.
or form.
Not at all. Sickening.
What else would you like to see the program do in the hospital?
Oh my gosh, they've been. You know what? They've been great. So I'm trying
No,
I'm trying to see where there's a need.
You know, in the expanding of it, you know, because we really have only been up and running really
60 days, right?
Yeah,
That's the,
2 months. I mean, it
Yeah.
seems, and a lot of people were serviced, which is really awesome.
Well, do you have a final count on how many people we've talked to
You know
yet,
what?
or?
So I should have brought those numbers with me,
Yeah.
but I believe that we are like at 99% of everyone that's engaged and given a description of the Sherpa program.
Yes.
Everyone takes you up on the offer.
Oh yeah, you know, I was just talking about this in a meeting actually yesterday, but it's true. Like, every person I go to talk to, they are like, please, like, they just want that help, and to have somebody come over and give them that time, and it's just been great.
Whereby when it was reported with overdose, oh, they just want to leave the hospital. They just want to get out of there. Big difference. It's not that they just want to get out of there. They just didn't have the right person to speak to.
Correct,
That has the ability to give them a half an hour and hold their hand and say, I'm so sorry that you're, you know, struggling with this. Let's help you find help.
Yeah. I mean, it's just been so great to hear the success stories so far too, and just hear, you know, we're at the beginning, so it's kind of just being able to engage somebody, I feel, is a success, because these are patients, a lot of them, like I said, I've been seeing for years.
Yeah.
And to see some of these patients who otherwise have not been able to really get the help that they needed or engage in the community, to see them starting to engage and participate in a lot of the activities at Thrive, for example.
So Thrive is our recovery center, and it's just exactly.
Right.
place for them to go.
Right. And you know, I find a lot of patients will say, like, I'm bored. I have nothing to do.
Right.
Okay. And Thrive offers that, which is lovely.
Which is, you know, people, places, and things, they always say. So when you have a new person in recovery that can be around other people in all walks of their recovery, and they're doing karaoke, and they're going, you know, whitewater rafting, and they're doing all of these activities, but they're doing them sober.
Right. And yoga's available too, which again is it's channeling mindfulness, which is such a big
Absolutely.
big part of
music
recovery.
is a huge thing.
Correct.
There. Art, you know, they do arts and crafts, which is also just another way to express, for people to express themselves.
Yeah.
You know, and so we talked about kids before, and what are the 3 things that a school district takes away right away? Sports, music, art, and art.
Yes.
So everything that gives a child the ability to take themselves out of themselves gets taken away from them. And then we wonder why substance use is on the increase.
I agree.
You know, we can raise the bar for education and what they need to know. That you can always raise that bar, because kids will rise up, but you have to take care of the rest of them.
Yeah, I mean, you know, we need to treat kids like kids too. You know, it's they're not little math machines.
No, they're not. No, they're not. And it's so important when they're outside playing. Not every kid has ADD. Like, I'm sure your son is 6 years old and in kindergarten. No one sits still in kindergarten. That doesn't mean they have attention deficit. It means that they need to go outside and play.
Right.
Especially when the weather gets nice, because they're all looking out the window.
Right.
Saying, I just want to go outside.
Yeah.
Look at the butterfly.
Yeah, not enough recess.
Not enough recess. Not enough recess.
Well, there's, you know, I've seen so many articles really to that, talking about that in the paper recently.
Yes.
About kids are being forced to eat their lunch too quickly, about how they really aren't spending enough time playing. They're not, it's not right.
It's too much of a, you know.
There's a lot of pressure on kids and their kids.
Too much pressure.
Yeah.
And they're babies.
Right.
They're babies.
Right.
And a lot can be learned at recess.
Well, just that social piece.
Of
that I
course.
feel like, you know, we're removing the social piece now.
We are.
Unfortunately, with the
And
phones, right? With the phones, and you know, kids aren't going out and playing in the way that they used to, because the world is a scarier place. And listen, I fall victim to it too. I remember when I was a kid, we all used to go out on our bicycles and go to the neighborhood kids and come home when it was dark, and that was that. I think about it now as a parent, and I'm so afraid to send him out on a bicycle. Like, what if he gets hit by a car? What if someone steals him? What if, you know, you think of all these things in this world, and, you know.
And you know what? To be honest, those things happened when we were little.
They did.
They weren't in the newspaper. They weren't on a 24-hour news. I even say it's a 36-hour news feed. I feel like there's so many more hours with the news of the same things, that they want you to be scared, that they want you to be this, that they, you know. Can your 6-year-old go out and ride his bike around the corner? Yeah, he can.
Yeah.
Because you're going to make sure that he knows, you know, if something, if, you know, you just come right back home, or you get him a play date in the neighborhood that they're both riding together. You remember how much freedom it was just to get on your bike and go someplace.
And it gave you something to do.
Imagination.
Right. And it filled that free time.
Yes.
That the kids are now filling with other things.
With other really bad things.
Yeah.
They're getting into trouble. You know, and you know, so we talked about families. I know too, when an 8, 9, 10-year-old comes home, and every day mom and dad comes home and says, I had a bad day, I'm having a glass of wine. That an 8, 9, 10-year-old comes home and says, well, I had a bad day. Maybe I'll have a beer too, like my dad does, because my dad's my hero. My mom's my hero.
Right.
We need to give kids a different example.
Absolutely.
Not saying that you can't have a glass of wine, but maybe you want to have that after they've gone to bed, or come home and say, hey, I had a bad day. I just want to have dessert for dinner. Let's have Sundays for dinner, and if we're still hungry, we'll eat. And I'd love to just cuddle with you on the couch and let's watch a movie. Because that's what I need. I need my family now.
Yeah,
Just-
not a glass of wine.
Just a different messaging.
Yeah, I mean, you
And
know,
mom
you
and
see
dad
it-
need to put down their
the
phones, too.
Right. I mean, I see a lot, you see online really a lot of this whole mommy wine culture that's coming, not saying that it's new or not saying that, you know, but
it's celebrated in a way.
It is, and I always find that very interesting that, you know, moms can be like, oh, I'm just going to go home and have a glass of wine and I'm going to, you know, it's wine time. And,
or they're bringing that
right,
to school functions with them.
right. And I just,
Which is a whole nother ball game.
correct, yeah. And it's interesting because, you know, these are also, this is how it starts. This is the beginning of it, you know, and a lot of people don't see it that way. It's a different kind of, I mean, how is it really any different for this
isn't.
mom drinking, you know, oh, I'm a mom and I'm going to my yoga class in the morning and I'm going home and I'm drinking my bottle of wine throughout the entire day because I deserve it and I'm a hardworking person. How is it any different than the person who
Struggles.
right?
Right.
They just haven't
crazy.
realized that they're struggling. They're going to be struggling if they
going
keep
to be
going down this
struggling.
road.
Right.
It's just interesting that
And the impact, you know, we always
Right.
talk about the young person that's doing substances. You know, in Kings Park last year, 2 high school kids found their parents overdosed. Their dad had passed, and I don't remember, you know, the mom didn't, but I don't know where she is today. But what they lived through, what they went to school with, and is anybody talking, you know, we need to have more communication in school.
Right.
Like, is everything okay at home? They need to have a place where they can all go and have somebody right there to intervene
right.
in that, you know? It's crazy. It's a crazy thing. And then, you
Maybe
know,
we need to have Sherpa in the schools to find somebody to connect with
yes.
kids.
You know, not
Right.
every school district. East Northport has a KSAC in the school.
Oh, wow.
Yeah. But then parents will say, you know, when you bring services into, and I'll use Kings Park, they used to have some services from a local community would come in, and then the parents said, I don't want you talking to my kid unless I know about it. Well, you would take that resource away from your child? You don't need to know everything. And if that's the one thing that stays between, you know, I don't know.
Yeah, I mean,
You never
again,
want to
you
go
wanna-
down the road that I went down.
No, I know. Yeah, that's,
You know, and that's why I'm so, you know, really so grateful to be able to really help families separate themselves from their loved ones' disease, because they're entitled to their own lives. And it doesn't work when you're on top of the person struggling. Thank you so much for coming tonight.
Oh, thank you for having me. This has been wonderful.
And we're going to put it on in the feed in the waiting room
Ooh.
at the hospital. Thank you for joining us this evening. I hope you have a blessed weekend. Hopefully it'll stop raining. Hopefully it gets a little warmer, and enjoy, you know, embrace somebody today. You know, let's start talking solutions and not accusing people of problems. Have a great week.